And so I think like pictures are worth 1,000 words, and really looking at cases and looking at the pictures and hearing what patient's experience was is worth so much more. So we have a few cases to talk about, and I'll let Dr. Langdon talk about the first case.
This is one of our patients that we saw fairly recently. We had the express lift, facelift, and on the side view, you can appreciate what we mean by the cervical mental angle. Oftentimes, that sagging is really accentuated in the area below the chin, toward the middle of the neck, and then it's just lifted, and we see much better definition of the jawline and even the underlying structures in the neck. That's one of the criteria for a youthful neck, is that there not be too much volume under there and that it not be sagging. And then the jowl, once you're above the jawline, the folds that develop from the nose down, the nasolabial fold, and then the marionette fold from the corner of the mouth down toward the jawline, those are improved because of that lifting of the SMAS fascia.
In the second case, we can see the really dramatic effects of the combination of the CO2 laser and the face and neck lift. So the face and neck lift provided a really dramatic lifting of the neck and of the face, and that really wouldn't have been enough without doing the CO2 laser resurfacing. As you can see, there are a lot of deep wrinkles and folds in the cheeks, which have been dramatically improved. Now, there is a little bit of background rosacea. That's something that we're treating. That's the redness in the middle part of the face, but that's something we're addressing separately from the facelift and the CO2 resurfacing. So really, I mean, there's a lot to facial rejuvenation that is the combination of lifting the face and lifting the neck and also resurfacing the skin. So it's a really great idea to be able to combine those two procedures and just have that one recovery and, consistently look about at least 10 years younger, if not more. I'll let you decide for yourselves from looking at the pictures.
All right, and then another group that we haven't really specifically mentioned are men. So like most cosmetic surgeons, majority of our patients that we see are female, but men, of course, also have the same type of aging, especially with sagging. Interestingly, with men, the neck is oftentimes a bigger concern than the face, and we can get great results certainly with the facelift. And then sometimes we'll even do a almost not minimally invasive procedure like the no scar neck lift, and because that gives a strong and permanent lift to the neck, that's frequently a good choice for men.
I mean, I think one key thing is that the face and neck lift and all of these procedures work really well for men as well. It's not that it is only something that women benefit from, but men are also able to go back 10 years in time. So it's a little bit less common, I think, and there might be some stigma tied to men doing cosmetic procedures and something being maybe not quite so manly about it, but who doesn't want to look younger? Who doesn't want to appear 10 years younger than their stated age? I think that's, something to be talking about, something to be thinking about, and also important to go to someone who's performing these procedures also on men as well. Because there are some differences in terms of how you're going to want to approach doing the lifting and where you're going to need the volume, and there is a customized approach to that. that is important to think about as well.
So just like for women, for men, of course, it's a big advantage that, it not look obvious that surgery has been done. Men typically, of course, their hair is shorter. Women with longer hair can, the hair can actually cover the stitches even before the stitches come out. And the swelling we typically see is more, back toward the back part of the cheek, more in the area in front of the ear, really not that much in the neck. So men, of course, they're going to be a little more exposed, while they have stitches. But once they have healed, again, our typical, patient, no one knows they had surgery. Everyone knows they look better. They're just not sure. They can't figure out why.